For more on today's protests, we're joined by Natalie Mehra. She is the Executive Director of the Ontario Health Coalition and one of the rally's organizers, and she joins us live from Oshawa, Ontario. Natalie, thank you for taking the time tonight.
Thanks for having me.
So you were outside Toronto General Hospital today because of what's going on inside. How would you describe what is happening in hospitals right now?
Well, I mean, it was a crisis, months ago. It is now really collapse. I hate to use the word, but we've seen almost 100 temporary emergency department closures. Every week, we're getting more notices into our office of emergency departments closing because they don't have enough staff. There are maternity departments closed. There are ICUs that have been closed for weeks at a time. These are the most urgent kinds of care that we have. And when you're seeing that, what else would define a crisis in the healthcare system? So we're just stunned that the Ford government has tried to make this debate about whether or not there's a crisis. Of course there's a crisis. The question is, why are they doing so little about it?
So what needs to be done about it right now?
Well, if we were to see a government respond commensurate to the emergency that we're facing in the hospitals, we would see Doug Ford on TV calling back the retired nurses, people who've recently retired or retired out early, calling back the health professionals, asking them to come back, removing all the barriers, paying for their licensing fees, guaranteeing hours, promising some hope to the remaining staff in the public hospitals that there is actually a light at the end of the tunnel, that they're actually going to get boots on the ground as soon as possible, not months or years from now, but actual staff into the hospitals to lighten the load and to make it possible for them to do their work. They would be calling on the public, please, to mask in public places. These are respiratory illnesses that are preventable if we take the measures to do it. They would be asking people to vaccinate for COVID and for the flu. We still have a big burden of COVID in the public hospitals. All of those things could be done, should be done, but they are not being done.
And tell me about what you're hearing from healthcare workers and what they're facing. What kind of situation are they in?
Well, we've got half of a cafeteria in Sick Kids Hospital that's being used as hospital space for the overwhelming number of children they have. We have emergency departments that are just completely overburdened, every bed full. By that, I mean a staffed bed that's in operation. It's got staff and it's a running bed in the hospital. They're all full. People on stretchers in every area, people waiting. We're hearing from patients waiting 18 hours, 21 hours, doctors telling us it's taking 5 days to get patients into a bed in the wards because all the beds are full. And at the other end, pressuring the elderly patients to move them out of hospitals to all kinds of places across the province that they don't want to go to because there are not enough beds. Just an avalanche of patients without enough staff. Even if the hospitals were running at kind of normal levels, we have a critical staffing crisis, the like of which none of us have ever seen before. It's just a terrible mess out there.
Do you think they're hearing you? Do you think the government
I
is
don't know what the Ford government is doing. I've been doing this since the 1990s. We've been through multiple governments, multiple health ministers. I've never seen a government back in the 90s when they cut all the hospital beds. There was a huge crisis. Joshua Flewelling died in an ambulance because all the emergency departments were on redirect. And the government totally turned the ship around. They increased funding dramatically. They took emergency measures. That was the Harris government. I cannot believe we're going on month after month after month of this in Ontario, and really almost nothing is happening. I mean, objectively, almost nothing is happening to deal with this crisis. The hospitals cannot do it themselves. Clearly, they can't. They haven't been able to. This is going to take provincial government leadership, and we're just not seeing it.
I really appreciate you taking the time tonight. Thank you very much.
Thank you so much.
Natalie Mehra is the Executive Director of the Ontario Health Coalition and rally organizer in Oshawa tonight.